further. Thank you, Margot. Okay, welcome everyone. Michael, reminder, I think Michael is going straight into the Spanish channel. Excellent. Okay, so welcome everyone. We have a couple of new colleagues or colleagues that haven't joined the previous meeting, so wanted to make sure that, hi Matito, making sure that everybody knows who's who in this meeting, starting with me, because I haven't introduced myself. I'm Florence Martin, the Executive Director of Better Care Network, and delighted co-convening this group together with colleagues at Lumos. So I will just hand over, maybe starting with my co-convener, Pete. Would you like to introduce yourself? We can't hear you, Pete. You're on mute.
Sorry, Pete McDermott, CEO of Lumos, and I'm co-convening this informal group with Florence. So thank you for joining us.
Great. I'm going to do it according to who I see on my screen. So, Mara. Nolan.
Hi everybody, I'm Nolan Quigley, Senior Global Advocacy Advisor at Hope and Homes for Children, representing Mark Waddington on this call.
Thank you, Nolan, for being there. Eric. Thank you, Eric. Philip.
Hi everyone, Philip Goldman, President, Maestro International.
Thank you. Becky.
Becky Smith, I'm the head of child protection programs at Save the Children International and the co-lead of the Global Policy and Advocacy Group with Florence.
Thank you, Becky. Greta, welcome.
Hello, everyone. I'm Greta Massetti. I'm the Principal Deputy Director of the Injury Center at the U.S. Centers for Disease Control and Prevention.
Welcome, Greta. Great to have you here. Britta.
Thank you, Greta.
Hi, I'm Britta Holmberg. I'm the Program Director at World Childhood Foundation. I think my colleague Jewel, our thematic lead on alternative care, will also join us.
Thank you, Britta. Margot.
Happy Friday, everyone. I'm Margot Cornelius. I'm the Knowledge Management and Communication Specialist at Better Care Network.
Margot. Matito, welcome. Great to reconnect. Thank you, Matito. Michael, welcome. If you can introduce yourself.
It's a real pleasure to be with you, Michael Londoño, and I am founder of the Association of Caregivers in Colombia and part of the network of caregivers for Colombia and Argentina. And I am I'm also coordinator in other activities. It's a real pleasure to be with you all.
Thank you. Thank you, Michael. Great to have you. Mariana, welcome. Thank you. It's fantastic to have you all here. So I'm going to hand over to Pete just to remind us a little bit of what we discussed at the last meeting, and then we'll go straight into business with updates on progress and discussion around the different activities that we need to move forward. Pete.
Thanks, Florence. Yeah, so the genesis of this goes back 6-9 months. As many of you know, last year we had some discussions, in fact, with Greta and her colleagues and Florence around data and the absence of it, and whether the current global mechanisms of DHS and the violence studies and MIX and all the others were actually capturing children outside of family care, those in institutions, on the street, on the move, and how would we look at what we were calling at that time a data deficit? That merged into some then preliminary discussions with WHO and UNICEF and others. And then I was involved very much in some of the early brainstorming and planning meetings with WHO, looking at what that violence against children, what is ministerial conference now, became. In that period, we also started earlier this year discussing with you individually about how can there be a global ministerial conference around violence against children, and yet there doesn't seem to be a way of capturing children who are some of the most vulnerable to violence, both at the household level, when they're separated, and when certainly they're in institutions. And that led to a discussion around how could we then work with WHO and the other co-sponsors, Sweden, UNICEF and others, to try and see if we could get some attention to this group, given the fact that violence was a key driver of separation in the first place. And then secondly, once children separated, institutions and elsewhere without protection of the family and often other protections, and therefore, devoid of care rights, and because of the data and evidence deficit, really invisible. So that was the genesis, and part of the early discussions were, would a small group informally, without making this a sort of a UN committee, be interested in looking at how could we either work with WHO on the main agenda item, or if not, as it proved not possible, how could we then do something that was complementary to those 2 days? And WHO and Sabrine and others suggested that we look at a satellite. We came together in the first meeting really to validate, was there a consensus that this was a good idea? Some questions about how wide or narrow the scope would be. We were also trying to look at the care and protection nexus, as well as some of the issues about, there are multiple initiatives now related to the ministerial conference, including, whether that's online violence, education in and around schools, special initiatives around disability, mental health, and how could we make sure we weren't duplicating efforts, and how could we also make sure that not only were we working in terms of having a discussion and hopefully some recommendations coming out of our community, the care community, but also how could we engage with those other satellite and other initiatives to make sure we were working to put care, and especially care of vulnerable subgroups, into some of those other wider agendas which weren't yet capturing that. We're pleased that we've got Greta and others here today, and Matito from USAID, who at some of the discussions that we had last year around the data, and also Florence has put some background work together with Lumos ourselves around some of the earlier initiatives that happened 3, 5, 10 years ago, because it's not the first time that we've tried to do this. The consensus coming out of the last meeting was that this was a good idea. We should try and focus in on a scope for the satellite. We shouldn't be trying to be too ambitious. We should take some learnings from what others are doing, so we're not duplicating it. And also, with Sabine's help, we did get a permission, if you like, or encouragement to hold a satellite. And so Lumos has made some funds available, to continue through BCN and ourselves this consultation process, but also we put down some deposits for the venue itself in Colombia, and also we've trying to lock in some translation services, and we're beginning to reach out for ideas and speakers. And so the plan from last week to this week is, now we've got some of the logistics in place, and some colleagues have joined us today, CDC, USAID, colleagues from from World Childhood and others. There is genuine momentum, and I have to say WHO and others are very, very supportive of what we're doing, and behind the scenes, helping us get this satellite up and running. What we have to do now really is to turn those intents into a little bit more discipline, and we'll take you through where we are, what we're thinking about. There were some initiatives that emanated out from last week, the last meeting, about having some sort of summary evidence. What is the state of the evidence? What is the state of the data? Some thematic brief where we could try and coalesce around an advocacy agenda, primarily looking at both the policy areas, but also some of the practitioner issues like data, like evidence. There's another aspiration subject to funding and commitments from ourselves. Can we do and could we do in time some quick analysis of what's going on in certain countries? It has to be depending on where our capacities are, individual organizations here today and others stepping up and taking the lead. And that also will link into some of the agenda items today about the preparatory meetings that are taking place and how we can influence some of those delegations going to the ministerial conference. And there are a couple of other associated initiatives that we'll explain around webinars and supporting meetings. So that's a very poor summary of how we got here today and what we're trying to do today. But I really thank people both for joining the meetings, but all the very active dialogue that goes on between the meetings, where we've got some initial strands of work developing. Florence, back to you. Thank you all.
Thank you, Pete. No, you've done a great job at summarizing, as always. So as you've said, we identified some key aspects of advocacy that we already saw as critical to ensure that we bring this issue to the agenda, and not just to the conference, but to the preparation and as well after the conference. One of the things, of course, is the satellite event, and we'd like to deep dive a little bit with you on this. At this stage, maybe not as the first agenda point, but to say, as Peter said, that the Lumos team has been brilliant, has been securing to make sure we've got the venue. And one of the fantastic piece of news that we shared with you earlier, which is that the representative of the Secretary General on violence against children, Najat, has already agreed to be one of our key main speaker for that satellite event, which is fantastic, not only because she's clearly driving this process globally and the work, but also, as all of you know, she's an amazing advocate. She's a person that is deeply concerned with the relationship between violence and care, and she knows it extremely well. So it's fantastic to have her, and it's a tribute to her commitment to this issue that she literally responded so quickly to say, yes, count me in, I'll be there. So that's fantastic. The other points that we wanted to bring you are these different aspects that we discussed last week, and maybe some that we've missed, and identify how do we move forward. We've shared with you, and I'm going to share it. I suspect that you're not going to be able to see very much from my screen, but we shared with you a document that we created as a work stream on this issue. Let me see whether I can do this. And whether you can see anything, which I suspect you're not. Are you able to see my screen?
Yes, Florence, we can see it.
Fabulous. So there were, I think one of the things, as Pete said, that we were clear that this opportunity around the conference is not just a one-off. We're not just there, to add a voice to the conference, but it really is the opportunity to integrate through both a process, but also that starts before, and integrate our work in the critical work that's happening on violence against children globally, including the work that's happening in pathfinding countries, across national plans and implementation, to make sure that the question of violence against children, both in alternative care, but also as a driver of children losing parental and family care and going into alternative care, is addressed. So there are a range of opportunities that we started to discuss, and one of the first one that we identified is it's going to be really important to be part of the preparatory, to the extent possible, to have organizations working on children's care mobilized in the national and regional preparatory meetings. We have got a little bit more information, thanks to Sabine, about the countries that have already committed to do a national preparatory. We've added them in the tab here. And you'll see that it's actually quite a large number of countries that have already, although I understand that some of these countries are still, there's still discussion around funding to enable them to participate. But these are countries that have agreed to set up a national preparatory process. And that includes bringing together civil society actors at the country level. And it includes developing a kind of agenda, a kind of national commitment in terms of ending violence against children. So it's a great opportunity in the countries where we have partners, network members, stakeholders who are working to actually ensure that this issue is at the table, to ensure that our practitioners, our care experience advocates are also part of these processes to influence what comes out of that. Because whatever those pledges, whatever those national commitments that are being made, they're going to be taking them to the discussion in Bogota, and that's going to inform the actual political declaration that comes out as well of the ministerial conference, as well as the aftermath, the implementation. So one of the things we wanted to flag with you, and to also look for your thinking, your leadership in terms of where you see that there might be opportunities for you and your partners to support and engage with these processes, to really have a look at the countries that are involved. I know some of you are working in many of these countries, and to start identifying and engaging with the actors that are organizing those preparatory meetings, and identifying, what is happening, what are the opportunities at those levels, what are some of the things that are coming up of those processes, and how do we ensure that the intersection between care and violence in all the ways that we've discussed are at the table as part of these processes. So at the moment, we don't actually have that much more information about what's happening in those countries beyond that they have made those commitments and that there's some fundraising for some of the countries happening. But what we wanted to do was to flag this, to ask you to identify, not necessarily in this meeting, but as you go through it. And first of all, if you're already working, if you're already in a country that's doing the work on the preparatory session, it would be great to know. But if you're not, looking at the partners there, looking at your work there, and seeing, is there an opportunity there to be involved in those processes and to influence them? We're seeing many of the countries in there are countries that we are all involved in one way or the other, where care reform processes are happening quite significantly. Clearly, just looking at this list, Kenya, Uganda, Zambia, it's also true. It's actually also true of Ethiopia to some extent, Malawi. These are, and even Tanzania, these are countries where we know there is work happening on reforming care systems. And we also know that we've got, in some cases, care leavers network. We have programmatic program that are addressing the range of issues facing children in alternative care. So in terms of this opportunity, it's really a question of asking you to identify, and through your partners, identify the countries that are on that list, and identifying, are there opportunities to get involved and influence that agenda. So just wanted to flag this at this stage. We are going to try to gather, but we do, this is where the partners that are working at in those countries are going to be able to come back and take leadership in terms of influencing those agendas. In terms of Latin America, I know that there's so much activities happening at the Latin American level, but you can see that quite a few of the countries where care reform work is happening are involved and have made commitments. So it's a huge opportunity in terms of influencing that. Just wanting to leave it open, as I have my screen, I apologize if I'm not seeing people, but just to leave it open if there are anyone who has any comments or information around this nationally preparatory process, or questions, or want to add something on that. Still very initial. The list could grow, by the way. This is the list that we have. Becky, please.
And just to say that, say the children's trying to engage in as many of these as possible. So if there are specific messages, and we're trying to give some advocacy messages to our country offices on what we want them to be bringing forward, and to make sure that civil society is included, if, you know, UNICEF, WHO, et cetera, are coordinating. So very happy to help disseminate any, you know, core messages that we're really trying to get across.
Fantastic. Thank you.
Florence,
Yep.
I'm curious, you know, Guatemala changing the way we care has a lot going on.
Yep.
They're in the region. I'm just really surprised they're not on the list. What can we do to get countries like that? I'm sure it's not just Guatemala that are not on this list to show up if, you know, we can use our networks. Who do we approach specifically?
So there is a process for countries to agree, and in the shared folders that we shared with you, if you haven't seen it, there are a conference document, and within that there is an actual document that addresses what a country needs to do to become you know, one of the I forget what the name is, but one of the key contributor that has agreed to be part of that list, because also it's linked to this recommitment to pathfinding countries. It's linked to the follow-up process. So it you know, the document explains what is expected of a country that would be on that list, and what are also the opportunities. So I will reshare that with you. I think I suspect there's a lot you can do, including in Guatemala, you know, with Changing the Way We Care, where you can actually reach out to your government counterpart in the relevant ministries, let them know about this, and ask, you know, are you planning to be there? Why aren't you? And then identify with them. Some of it has to do with consultations. There has to be consultation at the country level between different ministries, relevant ministries, with civil society, with key actors. And so, you know, identifying how you can support them to do that. But it would be fantastic to, particularly in countries where, you know, you have significant work happening and progress with these ministries, to make sure that they know that this is a big opportunity to
That'd be very cool.
commit.
Thank you. Thanks, Florence.
Yeah. Britta, I think you are next.
Yes, and thank you. And I think just to add on to what Greta was saying, I mean, we have partners in many, or a couple of these countries, mainly Thailand, Cambodia would be most relevant, maybe also Moldova, Poland, and Sweden. It would be good to have, if we can have a joint document or something where we can just kind of update each other and align with kind of key messages, but also maybe if is it about just ensuring that the right partners are aware of this process, ensuring that they are invited to the process, is, you know, can we agree on some kind of key advocacy message that we want to help them convey, kind of how can we align these issues? Because I assume some of us are in the same countries, and it would be good just to coordinate.
Absolutely. That's a great idea. Thank you, Britta. I don't know who was first. Eric?
I think I was second.
Okay.
Mara
Well,
was
go
first.
ahead.
Okay. Mara, you go first. I'll go right after you.
Mara. Eric.
Yes, so a few people have talked about the importance of outreach to get the key players and countries involved and stakeholders involved. And I'd just like to strongly encourage that when you do that in any country, that you look to organizations of people with disabilities, that you know, there may be a lack of communication between some of the children's organizations and the disability organizations, and let me just say the fault is on both sides. That disability organizations very often overlook children's issues because they are so engaged in the empowerment of adults with disabilities that they may not have adequately looked at these kids' issues. And so active outreach to those disability groups, because if you're going to be fighting institutionalization and creating inclusive societies as a way of stopping the violence, you've got to include the adult organizations of people with disabilities, and also to be aware that the disability organizations in your countries are all underfunded and underdeveloped organizations of people with mental or psychosocial disabilities or cognitive disabilities, may not even be a part of a mainstream disability organization. So to be aware that these groups are fragmented, and that if you get one representative, you may not be getting a representative of a whole of the key constituencies. So to really work at finding leaders both in physical disability and in cognitive, intellectual, psychosocial, and those organizations are functioning at a really basic level. They need to be engaged, and they will probably be not aware of this whole process unless there's some form of active outreach, which I strongly encourage. And in any country, if you need help, please feel free to reach out to me, and I'd be happy to do whatever I can to connect you. Thank you.
That's a great point, Eric. And yes, I'm sure that actually people will reach out to you in terms of identifying those organizations at country level. So that's really helpful. I'm probably missing, I'm not seeing another hand, but I think we've got quite a few action points and follow up on this one. I see that Amanda's joined. Welcome, Amanda. Just wanted to acknowledge you joining us. Okay, so this is in relation to the national, and as Mara pointed out, potentially the regional preparatory sessions. So we really want to be ensuring that we engage with that. It's absolutely critical. There is another opportunity. We said we want to look at a range of opportunities to actually really ensure that the question of children and care is, is integrated into both the concern, but also the data and also in terms of the practice and the solutions that's in the recommendation. There's a series of webinars that Becky kindly flagged with us that are being established, that are being organized before the conference to bring in different aspects of violence against children and do some some good practice sharing and learning and start gathering some of the key recommendation around this. It's organized by the Institute for Security Studies and together with, and Becky, correct me if I'm wrong, but with WHO, I know Save the Children is playing a key role. There's a range of agencies. So we reached out to them, having identified two particular sessions where there's an opportunity to engage that's extremely relevant to the work around children's care and so on. One, which is a webinar, they've been categorized according to key aspects that overlays the issues around INSPIRE, the articulations of key areas of action. So one is around safe environments, and another one is around response and support services. And we reached out to the organizer just to see, is there space and would you be interested? And we proposed a couple of particular areas for this. One in relation to safe environments, having good practice in particular in reintegration of children that have been placed in alternative care due to safeguarding concern and their reintegration back into family-based care. We know that this is one of the critical aspects of ensuring that children are not institutionalized and do not remain in alternative care when they can be reintegrated into family. But we also know that violence happens in family. And so in this case, it's understanding and showing the practice around how do we work, what is our practice, what are our lessons learned in terms of how we reintegrate children into their families safely, where they may have been safeguarding concerns. And so that was one aspect, and the organizers thought that would be really spot on, and they would be keen to learn that learning. So we started, but we want to reach out to you and say, because we know that there are a whole range of countries and practitioners that are doing work on different aspects of that, to start thinking what could be some of the good practices and what would be a good example to provide. To add, these are webinars refocused on practice and solutions. So we're looking really at having an example at the country level of this type of work and how it's being done and how it's impacting. So very practical. So fairly, the opportunity is fairly limited. As you know, webinars are always, there's going to be a number of speakers. So it's going to be not just this speaker, but it's about a 15-minute presentation. But it's a real opportunity to highlight and showcase some actually critical learning in that regard. So we started just literally, this is just an initial brainstorming. We need you to also contribute to this and identify what would be a really good country example or practice example from a country that you're involved in that could really reflect some of the learning in there. So we started thinking, for example, of some of the work that's been done in Uganda, particularly reintegrating young children and infants. That's one possibility. There's some very interesting work in Lesotho on reintegration of street children in kinship or biological families. There's some really interesting example with a fantastic organization in Madagascar. Cambodia, of course, there's quite a lot of work being done on this. We could add a whole list of it. We're going to need to identify one, but this is just an initial brainstorm. So if you have partners, practice that you know, and you really think this would be a really great opportunity to showcase some good practice, we ask you to please identify them and let us know, and we can have a discussion. And at some point, there's going to need to be a decision, but we want to get back to the organizer pretty quickly. They've agreed. They said this is great, but as you can imagine, lots of other people are probably going to be jostling for the space. So we want to make sure that we can quite quickly work with and finalize this. The second one on response and support services. What we proposed on this is a practice example around supporting the use of foster care, including trauma-focused foster care or trauma-focused practice in foster care to support children who've experienced violence. One of the key role, of course, and one of the key challenges, alternative care is critical for children who've experienced violence. Family-based alternative care is, as we all know, the priority. And therefore, we need to be able to showcase how that is possible, how there is foster care that can really particularly respond to the need of children who've experienced violence. So again, we started thinking of some of the amazing program services and partners that are working on this. And we started to identify some of the potential. We'd love to have other examples. And so, and I should add that providing the example here is not just for the webinar, but it's actually going to help us as well when we get to the thematic brief, because there will be multiple opportunity to capture and showcase those examples. So, while in this case, it's in relation to the webinar, even if the practice that you've identified, the partner you've identified is not the selected one, there's an opportunity for their learning and practice to be showcased as part of the events, as part of the thematic brief, etc. So this is to flag to you this opportunity. Please let us know. I would suggest if you can sooner rather than later, because we'll need to get back to the organizer of this webinar with some final proposal so that they can organize. So just, if there's any questions and so on, please let us know. But hopefully that is fairly straightforward. Then we talked, of course, about our, we talked, the last meeting, of course, about the call by Daniela from Together for Girls, who talked about the opportunity for care experienced individuals to be involved in the Survivors platform and initiative, which is going to be part of this event. So the deadline has passed, but hopefully this was widely disseminated, including across networks of care experienced individuals by Michael and others. So it'd be fantastic, and hopefully Some of them have been able to be applying to be part of this process. We know less about the children and young people movement, if you do. I don't know, looking at you, Becky, but I'm not sure whether SAVE has been involved in this. We don't actually know very much what shape or process. There's a little bit of information out in the conference document where they talk about a cohort of 10 representative young champion for change, but we don't really know very much more than that. Do you have something, Becky?
Trying to raise my hand and I
Yeah,
can't.
please do.
I mean, so I know Save the Children's representing the CSO forum so trying to really make sure that children are included in many of the sessions in the formal meetings, but also in the run-up and definitely working with our regional colleagues on children who are already there in the region. So something we should definitely connect on. And then Restless Development is supporting groups of young people, which I think is what we're trying to collaborate on to make sure that there's space for both. And of course, Brave is supporting survivors to speak out on their lived experience of surviving, violence. So I think, happy to just keep coordinating with Barty to make sure that there are connections. And if there are, we want to make sure there are space for children, but definitely we can coordinate with Restless Development also on their young people's panel, because I think they're trying to make sure that we don't want to have a competition between a young person, a survivor, and a child, but we want to make sure that everyone's experience is fully reflected. And I think that's something that Barty is working on. But definitely let's connect, especially with the care leavers and people who want to be involved.
Thank you, Becky. That'd be great. So definitely reach out to Becky, and maybe we could get Barty at the next meeting come in and or if she's available. That would be fabulous. Thank you. Mariana, I see you've got your hands.
Thank you, Florence. It is true that from the Latin American Network, the Youth Committee, we have shared that postulation so that care leavers can be there in the conference, in the space of survivors. And besides Michael, that is with this, which is here with us today, we have also done it with a young person from Brazil. And on the other hand, here in Argentina, we are in the process of preparation of a preliminary event before November. This event will be at the end of June, and the initiative Inspire, that is in Buenos Aires. It has been presented as an amicable city and committed to implement this methodology. So it will be the city for this preliminary event that is being organized. And this is the news I have. And we're also trying to contact those that are organizing Honduras. We haven't been able to know who in Honduras is the person of contact. If you have that person, to let us know, because that would be fantastic. We have been trying to do it through UNICEF, but I have the impression that maybe there is lack of communication that has not been reached yet.
Thank you, Mariana. It's fantastic to hear of these efforts. And if you can share as they develop more information, that would be really useful. And we'll definitely follow up as well on Honduras to make sure that you've got a contact. And I think maybe some members of this group as well may be able to respond with their own partner, but definitely follow up on that. That's great. Thank you. So in terms of the Global Ministerial Conference itself, one of the things I wanted to flag, which I think you're all aware, but just wanted to flag, there's a Friends of Conference. So these are countries that are part of, I guess, the organizing committee. And so these are critical countries in terms of, any outreach that we can do, of course, Sweden, of course, Britta has mentioned, but there are other countries as well in there that, you know, we as a community do a lot of work in. If it is a friend of the conference country, I think it's even more of an incentive to reach out to the authorities and the government partners there to make sure that you know, we're able to bring this agenda to their attention as part of their efforts. The deadline, I wanted to flag this, you're probably aware of this already, but the deadline for response by government in terms of their own participation is the 31st of July. So there's still many countries that haven't responded. So to Philip's point as well, you know, if you have a country, you're working in a country, you know, that's doing a lot of work on violence against children and on children's care, and there's an opportunity, that's the deadline to make sure that the government has responded, that they will actually be participating in this process. So just wanted to flag this to you. So one of the key things that, and Pete mentioned this earlier, that we all agreed we needed is to have a document that can be our kind of common advocacy document. And we talked about developing, we use the term advocacy, a thematic brief that can actually act as a joint summary of the evidence around the role that violence play in relation to children's care, as we talked always, both as a driver of separation and placement in alternative care, and as a pervasive reality and experience for children in alternative care, as well as when they leave alternative care. And so, and also the critical aspect of certain forms of care, in particular child institutionalization, being also a form of violence in itself. So there are different aspects in this brief. And we talked about having this joint document as our critical advocacy piece, that it would have, be targeted at the policymakers with very much action-oriented, because we want it to be a document that can be used by governments, by ourselves, by other actors, to see what needs to be done, not just what the problem is, and to be informed by the practice, you know, the good practice of countries and the evidence. We've started doing some work and together with my colleague Mara on developing terms of reference or a scope of work for this. We've shared it with you. It's part of the documents that you will see in the shared folder. We would very much like, it's a draft, we would very much like to have your input into this to make sure, you know, it's a so it's not going to capture everything, but the idea is to make, we started to unpack some of the key aspects that we of the links between violence and care that we think should be in there, and some of the, you know, the approach that would be taken for that. So one thing that we would ask for you, please have a look at the draft, and feel free to make suggestion if possible in suggested comments, so we can keep track on the comments. That's very welcome. Another key aspect of that is we've been discussing also with Pete and with others, you know, what the kind of profile, the consultant that can be able to do that. It's always a challenging piece. It requires different types of skill. On the one hand, we have the evidence need, and we already have we've highlighted in the document through quite a lot of the work that's been done around violence and care, some of the summary of the evidence, but it's actually quite dated. And even at that time, we recognized there were significant gaps. So we're going to need to do some update on the review of the evidence in relation to those links and those situations and their impact on children, and as well on the practice. But we also need this document to be very much targeted at policymakers, and so it needs to be an advocacy piece, not a you know, journal paper, as much as we would love to, and we are thinking of how would that then connect to potential, you know, journal papers and different types of resources that are also critical. But in terms of having this for the conference, we're looking at it as an advocacy document that summarize the evidence, that articulate what the key recommendations are, and then that highlight some of the good practice that we know exists on different aspects of that. So in addition to asking for your thoughts, your ideas in terms of the you know, the scope of work, and the approach. We very much need your thinking in terms of consultants. If you have suggestion colleagues that you work with and you think that is a perfect fit, we definitely are looking at the right people. We're having some discussion, and maybe Pete or Mara can mention, but we're having discussion with some of the research bodies and researchers to see whether they might be able to do some of the summary of the evidence. One example of that, which I think is fantastic news, is I was in discussion with Marinus Van Isidorn and Marian Bakerman, and who have done, as many of you know, some of the seminal work in relation to structural neglect, so child institutionalization as a form of violence. And they're actually working on an update of this article, and they said they would be very willing to contribute to this in terms of the evidence. And it's fantastic news, because the paper that they are producing is also going to be open access. So it's going to provide a much more accessible piece of evidence around this issue. But we've also been having discussion with other researchers. So very much ask for your help in terms of thinking as well of people who can help. Mara, please come in. Yes. Thank you, Mara. Exactly. And I will say, not only we need to move quickly, but we had a challenge about, can we move at all? Because we did not have the resource for this, and nothing can be done without resource. But I wanted to really warmly thank Britta and Joel and World Childhood Foundation that have confirmed that they would be able to support this work, without which none of this could happen. So we're really grateful. This is what's going to make it possible. And so we're grateful, and not just funding wise, but also technically wise, because also World Childhood has been doing a lot of work on this issue and research. So it's really fantastic news. So thank you, Britta and Joel, on this. We're really grateful. But yes, we're going to move quickly. So because the idea is for this to be available well before, including if we need a one-pager, including if we need an infographic, whatever we're going to need, it needs to be done well ahead, of course, of the conference, so that we can also have it translated and laid out and so on. And this is also where the country, your support, in addition to everything else you do, your thinking and your support and your contribution in terms of the country examples is going to be absolutely critical. This is often the part that gets really hard. Like we can kind of quite say, yes, we know we've got, some really good example here and there, but then, often some of it is not fully documented, or it's in a different format and so on. We really need your help in building those country example. And one of the things we discuss, and Pete, jump in if you have some ideas, is that, and also with Britta and Joel, is that right now what we're looking at country example for this brief, but we actually probably will want some deeper case studies of the country learning and so on. And that may be something that we want to have, that we aim for, not necessarily for the conference itself, but for after the conference, further work as well to really capture, because this is something that's missing in our sector, is really good documentation of the practice at the country level. Pete, please. And if I don't see your hands or your message, feel free to jump in.
Good. Thanks, Florence. Yeah, and again, let me just echo the Britta and Joel's support. Florence and I spoke to them at length a couple of days ago. We really welcome that. It also means that the funds that Lumos has available can be also then complemented, and we can not only do some of the funding for the logistics and our ongoing support to BCN, and also give Florence some other funds to bring in more people to help this process as we go forward. but we, like I think Britta and Joel also, and Florence has said, we would like to see if we can get some country case studies of some sort. A second idea would be to, if we're mobilizing some of these Pathfinder countries collectively, whether we could use that mobilization not just for advocacy purposes, but actually to draw together whatever data, evidence, grey literature, experience documents are, so that we can start using this mobilization process as a way of building up compendiums of literature from the bottom. And that would be obviously logistically challenging in multiple ways. It would give us some understanding of what materials do exist at local level that we may not be capturing at the global level. I'm really pleased we've got our colleagues from CDC and USAID here, because one of the issues obviously is going to be to look at this data deficit and evidence deficit that we mentioned before. And so I do think one of the sessions that we will have at the satellite will be around data and evidence. And so whatever we can inform that discussion by collecting some of the documentation and information at country level. One idea would be to come up with a simple template to see if we can capture in a comparative manner certain data and documents and evidence. It will also help us in terms of the negotiations and leverage with the preparatory commissions, so that going into the meeting, we can also make sure that the delegations going from countries have available to them whatever information we have at that country level. So it's a complex piece of work, but it's something that I think we will look at trying to find not just Lumos and World Children funding to support BCN and ourselves on this, but also hopefully other colleagues will join us, and either on a country by country basis or on a thematic basis, see if we can get some mobilized funds between us to at least get a small representative sample of country experience. Thanks, Florence.
Pardon me for jumping in. I had my hand up earlier, if I may. So I've spoken up in the past about the kind of silos that exist between the children's and disability community, but I see in this discussion another silo that needs to be connected. And that is within the human rights framework, within the area of international law. You're talking about evidence and documentation of institutionalization as an inherent form of violence. There's actually quite a bit of legal jurisprudence on institutionalization as a form of violence. And since this conference is in Latin America, in the Inter-American Human Rights System. So there was a report by the Inter-American Human Rights Commission on institutionalization of children, which concluded that it was inherently a form of violence. And there have been a number of very important legal decisions, a case out of Bolivia before the Inter-American Court on steps that legally need to be taken to protect against violence against children. My organization has just won a very big and important case that is not yet public, so I can't say what country it's from, that holds that institutionalization on the basis of disability is inherently a form of discrimination, and orders countries to provide reparations. The case applies both to adults and to children. There were children in the institution that we brought the case under. And so I strongly recommend that in terms of the work on documentation, that also bringing in the documentation from these cases and from the legal frameworks that countries are obliged to respond to would be a really valuable and important contribution. And I'm happy to have a whole discussion with whoever is working on that about how those legal frameworks can and should be included.
Absolutely, Pete. And just to say, of course, the brief will be looking at the international legal and policy framework on this as well. But actually, that's precisely something that you could help us and contribute. It'd be fantastic if DRI could help us by, contributing the articulations of the international law on this, as well as the inter-American law. That would be fantastic. Matito. Yeah. Thank you, Matthew. So that's really critical, and it would be fantastic to have your help, other colleagues. I know, Becky, you've also been very involved with the work on Inspire to help us think through how we can do this most effectively. Because I think that would be a very big miss if we're not able to, if we go in and as you said, almost kind of business as usual, if we don't recognize that one of the big objective of this is to integrate the critical work around these children and these issues into the existing violence frameworks, approaches, efforts. We are missing the massive opportunity there. I agree with you. It's almost an opportunity to kind of reset something that something that we missed quite a few years ago. So really would appreciate your thinking on that. Yeah. 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 Thank you. Very important point. Thank you. And I see Philip and Mav jumped and Brita. Thank you so much for joining. And we will share the notes, of course, in the follow-up. Any final thoughts? So again, the opportunities are quite massive, but we do need your support, your thinking, your leadership in terms of identifying the key areas and the practice that we want and the approaches that we want to use for this. One of the things we wanted to, and I'm not seeing Michael Convener, so please do jump if you think there's something that I'm missing. But one of the things we also wanted to talk more about is the satellite event, and we wanted to brainstorm with you, particularly more details about this. We started developing a concept note for this. Of course, we had to, when we registered, put the broad lines of what we thought it would look like. As we mentioned before, we've secured Najat's contribution to this. But we also started, let me stop sharing maybe here, so we can see each other. We started doing some thinking around the satellite event, and the logistic of it requires that we do some thinking pretty ahead of it, including how long, including how many people, and also look at the resources, what's feasible, because all of these things are very costly. and our resources are very limited. But we developed a terms of reference for the panel. Let me see whether I can pull it out. It's all of these documents have been shared with you. You know, we've been doing quite a lot of mulling, and I think, Mara, if I can say, we got to the stage where we're like, okay, we need help. And we need help in terms of, you know, what are some of the things we want to do. Let me see. Hopefully I can do this. Are you able to see the concept note? Okay, so we're not going to go into all the details, but there are some very practical aspects of it that we wanted. When we thought about it before, and we discussed it a little bit at the last meeting, we thought that this should be quite a substantive event. It's going to take place the day before the conference in order to capture, if you want, government representatives that are going to be coming in, that are going to be there, but not clash with the actual event, because that would be a recipe for disaster. So we're looking at it to take place on Wednesday the 6th in the afternoon, and probably at the Hilton Hotel, where a lot of the delegations are going to be, although there's all this question of costs and things that we're looking at. But we're looking at it potentially as a 2.5-hour session. We went through a range of different discussion on this. Is it too long? Should it be 3? Is that going to be too long? And all of this. But we thought that we wanted to be a very substantive session that really enables some significant sharing and learning around key aspects. It needs to provide an opportunity for extraordinary advocates like Najat to really articulate not just the international law and practice, but articulate what are some of the priorities and how, precisely to Matito's point, how do we integrate this critical issue better in terms of the work that's happening to address violence again, and eliminate violence more generally. This is the population that tends to be most forgotten and not included in a lot of the work and the action. So we also were very clear that it's absolutely critical to have care experience advocates at the center of this initiative, people with the lived experience of it and with the expertise on addressing it and on recognizing. And so delighted that Michael is part of this group, you know, supporting the thinking and the planning. So that'd be very important as we're in Colombia. Is to also have, and in the region, a representative of the Colombian Care Leavers Network, as well as the regional Latin American network, to be one of the key speakers. So we thought about having a first session that would have some of the key speakers on setting, if you want, the agenda, the tone, the goals, the learning, and then moving into a second session that would be more interactive, that would enable more discussion and more unpacking of certain aspects because we are dealing with so many different aspects of violence in this context as well, and different aspects of realities of care as well, both from the preventive and from the situation in the alternative care and after. So we were thinking of the first moderated session with key speakers that would bring in the evidence, that would bring in the key critical, if you want, goals around this and how that fits into the goals of the work globally, by having Najat, by having the expert with lived experience telling and sharing their recommendation on this. Also, and to Eric's, you know, always important point, making sure that we recognize that children and parents with disabilities are invariably not only overrepresented in the alternative care systems, but underserved by services. And so having this right at the front as well, potentially through a care experience advocates that can speak to this, again, thinking of lived experience being at the forefront of that. We also thought we're going to need a government champion. And this is ideally, and actually maybe 2. And I mean, Sweden, we talked to Britta and Joel about this, not only as a co-organizer, but has done a lot of work around addressing their own challenges, and they will speak better than I can on this, but some of that has been successful, and some of that is a challenge, which is very important to have countries that can speak to, having done the work, having walked the walk, and then realizing that they're still a long way from addressing it. And if the representative of Sweden is willing to really discuss this, that would be fantastic. I think it would set the tone. But also a government in another context, low middle income countries, that could speak to the experience and the work that's happening to address both violence in the system, in alternative care, and violence as a driver of separation, but also talk from the experience of how they are doing it, how they are recognizing, and what progress have they made, and what are some of the challenges. So having a government that can speak to both the violence and care work that they're doing at the country level and the efforts they're making on that would be really important. So that's one thing we would ask as well, of your thinking in terms of which government. I mean, we have lists of government we work with, we know the work that's happening, we know the progress on the floors, which government representative, first of all, would be there, because we need to think of a government that's actually going and it's going to be there, but that can also be an important speaker about that reality and that work. So that would be another potentially for this panel. We also talked about that integration with the work on Inspire, to Matito's point, but also to and really fantastic to have colleagues from CDC that major data gap that we have, and the need to address this in longer term. So there needs to be at that level as well, speakers that can actually speak to that question of the need to have better data in relation to violence and the intersection with care. And we also need to have a speaker that can discuss about how can we better integrate this reality for these children and the solution into the Inspire agenda, into the work that's happening through pathfinding countries. So space as well for that as part. So that's the kind of setting the scene, but also setting the kind of commitments that are around these issues, and how that converge, if you want, with the work and the recommendation that we needs to happen. Then we started thinking, okay, how could the next session be more interactive? And we were boldly thinking we could do small group discussion. And then we're like, we're talking about probably 100 people, and we realized that having small group discussion with a group that large, and the language requirements, because we are trying to, and it's going to depend on the resource, but we're aiming to have interpretation in at least Spanish and French, possibly Portuguese, and there may also be, of course, a requirement in terms of accessibility for disability. So all of this costs quite a lot of money. And if you start going that into small groups, then you have to have that at each group, and that's just, the reality of it is logistically and resource-wise is not possible. So we thought, okay, I mean, unless you have other ideas of how to do this, and we thought, okay, can we then do this into more of an interactive, but more, we called it chat show format, with a panel with a few speakers, and then interactive discussion with the audience, etc. And if so, would we have one? Would we have two? What's feasible? Do we divide it? Would we divide this by focusing on particular recommendation and solution around particular aspect of violence? And we started the list. They're not at all necessarily the ones, but we just started brainstorming. Or do we want a focus which is more around this aspect of how we can better integrate? So directly having, or do we want both? In which case we need to think of the length and the speakers and what are the things we want to kind of foster in terms of discussion and input from and contribution from the audience. This is brainstorming, as you can see, and we need your thoughts, your ideas about what would be most effective in, within the limitation that we have in terms of time and resource, what would be most impactful potentially, so that we come out of this with some really meaningful outcome and recommendations and thinking and next step potentially, not just for the conference, but for after that. It's a great opportunity to bring people together and have some really important thinking on that. But we're going to have to make some choices about both in terms of limitation and what works and what might be most impactful. So I'll stop to that. I don't know, Mara, whether you wanted to add anything in terms of the brainstorming we've done, but really to opening it up to you to be helping us think through. And it includes who should be on these panels. If we have a chat show panel, depending on what we're discussing, should it be if we're looking at solutions or if we're looking at, key aspect, is this where we should have the discussion around data and the lack of data, or should we be looking at it, in terms of when we're looking in terms of integrating into the VAC work and so on, or should it be where we have more discussion around the practice and the solution? Sorry, I'll stop here because I'm waffling on. Eric, I see your hands.
Yes. I'd strongly recommend on your plenary, if it's all possible as a plenary and not as a breakout speaker, having a representative of a major disability organization. It's a lot to ask one human being who's a survivor of childhood abuse and who also has a disability to speak for, such a broad population. Whereas a disability organization, there is an organized disability movement that have embedded within them many people who are survivors of childhood abuse. And so there is, for example, there's a coalition, an Inter-American Coalition on Deinstitutionalization, which is a regional disability coalition that we are working with. And in fact, it's on the agenda next week to talk about themselves holding their own satellite event. And so rather than parallel satellites events, it would be great if a representative of some of these global disability groups or one representative could be on the panel. I think a way of connecting the different communities that will be there.
That's a great recommendation, Eric. And if you can identify, you can share with us who and what, we can definitely put this on the agenda as a possibility, for sure. Thank you. Michael.
Thank you, Florence. I believe that this is a panel, an event that is very important. And representing caregivers in Latin America, this is the way to let people know the capacity that this youth have to contribute to change, so that children may be disinstitutionalized according to what they have lived, their perceptions. We can let people know of this process so that delegates from the different countries and other organizations may help to promote from public policies, because public policies are needed for change. There are many lived experience from many young people, but to be able to continue with this work, we need more support so that they can be mobilized, so that the capacity may reach other places. So I believe that this panel will be very important. From the Latin American Network, we have worked in advocacy on how to improve the alternative care, how to give voice to adolescents, children first, and through those voices, give recommendations from evidence so that the countries may transform the way that they care for children and adolescents. So that as a petition, understanding that these global organizations that contribute to that change in each of the regions from their work lines so that we can support the capacity of agency and also in resources to youth that is working in that change in care so that more children and adolescents may not have to go to institutions and that participation of families be strengthened. This is very important in the agenda. How do families participate? Because this is a topic I don't know if it's on the agenda, but I think that families and children and youth are the motor to be able to generate those changes that are required and those recommendations. So how do we introduce families to this? Because this will improve communication and we have a better cohesion in families. It promotes responsibility and the sense of being part of, and this helps to mitigate. And families may take that decision of taking their children out of institutions. So thank you very much. And I really celebrate this agenda where adolescents with care experience may talk out of that experience. Thank you.
Thank you, Michael. These are really great points. And it raises this question as well of ensuring that in addition, one thing we were thinking, in addition to the panel and having precisely those questions raised, that it also would be important to address that as part of the following up chat show discussions or whatever we want to call it, the more interactive as well. So thank you so much. We need to think about how to bring in, including this question of families and address and mobilizing parents and caregivers. Amanda, I see your hand up.
Thanks, Florence. I just wonder if we do it slightly differently, and I know this is left field, so everybody's welcome to ignore. But panel discussions are going to be something that everybody's going to have experienced all the way through. So I think that's quite legitimate to have it at one phase. But if you want to do something around a deep dive, perhaps one of the stimulants you could do is a bit like theatre for development or something like that, using an approach particularly then that would be all those with lived experience could be able to bring together either a piece of theatre or a piece of art, a presentation through art or something like that, which not only engages in a different debate and engages at a visceral level as well as at an intellectual level, because this is an emotional topic. So we have every right to tap into emotions as well as the intellect. And I think also what that does is it changes the dynamics around what you're speaking about and can be very powerful if we use, and it's one of the methodologies that will be used when working with violence, when you're actually working with in a trauma-informed way, will be using the creative arts. So in a way, you're also demonstrating part of the practice and part of the solution. So I just wonder if there's something there that could be done that could then stimulate conversations in a different way. I know that's very left field, so I'm quite happy for you to shoot.
Thank you, Amanda. I think that's a great suggestion, actually, and I'd love to do with anyone else who's interested, and I would hope Michael and others, Irene and others would be interested to sit and have a bit of thinking on that. I think that's a great suggestion. Thank you. We had not thought of that. So yeah, let's anyone who wants to be interested in discussing this, let's have a side discussion. And it could be that it's part of it. It could be that it's I don't know whether there is, and this is maybe some of you know that are more involved with the Global Conference Organization, whether there are any discussion around using this methodology, using art, using, as you said, theater, using as part of the conference, or is it all business as usual? In meetings and so on. If there are spaces, we should kind of know about this and see what we can do. And if there aren't spaces, maybe we need to create them. That's a great idea. Thank you. but we do need to be thinking about it fairly soon, because we're going to need to kind of firm up this process so that we can, some of it we've already firmed up, but like, even for example, do you think it's reasonable to have 2.5 hours? But if we're going to be thinking of chat show and speakers and representatives and so on, we need to be able to start reaching out and clarifying and confirming, because all of that has logistical and budget implication. Becky.
The other element is about systems, which I think is also going to be coming up, is how do governments invest in systems, which is about data, and it's about people, and it's about coordination. And I'm wondering if the government champion, or if there's questions about, you know, some people are working on a care system, some people are working on a child protection system, some people, you know, it's various different ministries coming together to support children. And I wonder if there's a way to somehow weave that in through the types of questions we ask. So not necessarily having something directly around child protection systems, but thinking about, you know, what is needed for a child to get the care and support, what is very similar to other violence prevention things, and then what's unique. You know, I think maybe that would be, it's just trying to think about the questions in the chat show that get it towards solutions, and kind of the areas where we know we're getting stuck. So around that data or people or types of alternative care placements, things like that. I don't know.
Yeah, I think that was that's absolutely critical, and we said all of it at the last meeting, that we want to make sure that there is a very clear system approach to, you know, and focus to what the recommendation, what we recommend. And we were thinking about it maybe more in terms of the second or potentially the alternative chat show that would kind of take more of a systems approach, not necessarily captured very well there, but we'd love to. Again, that's a great point. And so we need, you know, what we would ask is of you is to, you know, those of you who are willing to be part of a group to just brainstorm a bit more on this and start to concretely thinking, you know, what format do we use, what we want to focus on, it would be really helpful to have a call with you. And you can, of course, put some comments into this, but we do need to be narrowing down, and so we can firm up the agenda and start thinking of, you know, who needs to be there and who needs to participate and what are the logistical implication. One thing I didn't mention that, I'm sorry, I realized I'm not seeing the chat, is that we were thinking that it would also potentially be hybrid, so it'd be in-person and hybrid, and so that there would be you know, the opportunity to join online, and that has its own logistics, including quite a costly. So that's also part of where, and maybe it's a good segue. I know we don't have that much time. Maybe I'll reach back to Pete on this. Is that we do need, you know, all of this has financial implication. It has technical implication. It has know-how implication. So we need you to help us contribute to these different initiatives and others that you see that are missing. So would love to kind of follow this up before next meeting with a small group that are, if you're interested in, you know, all of you can comment and so on, but if you're interested in discussing more the format and the how and the who's, please jump on a call with us. We can organize and have further conversation on that, so we can hone in, but also think about what it is that you can contribute to this process. Because it can't happen without this. Peter.
Florence, let me echo that. I do think that, you know, this is where we either continue discussing or we move into a much more formalistic action plan. What I'd like to suggest, if I may, not everyone would, we assume, be able to afford anything. As I said earlier, we give Better Care Network an annual grant for operations. We're supplementing that now to get more of Florence and her team's time to take this initiative forward. There is a huge momentum here and a real opportunity. It would be a waste not to try and optimize that as much as we can. We recognize that colleagues like World Childhood, as we've said, have been very generous. We're obviously talking to others. But I think that in addition to that, we have a menu, whether it's on the mobilization in country X, whether it's bringing groups of care leavers together, whether it's the thematic brief, whether it's doing some of this grey literature at country level, data collection, capturing. I'd like to put out with Florence and others a sort of a matrix, and obviously we will have a column for a dollar figure, but we will have other columns where you can put a tick across and say, we would like to help in this area. We have a team in Kenya. We're going to team up with everyone else in Kenya. We're going to bring the wider CSOs community. And don't forget, we have 3 things we're trying to do here. Influence the preparation, make the satellite meaningful and action-oriented, and also having a plan of action afterwards to how we continue to prosecute this agenda, both directly and most importantly, as we've heard, with the Inspire framework and with some of the other efforts that are going on. So the satellite is a pivot point. It's not an end point. But what we can't do, sadly, at this stage is to continue solely to fund it and or have limited capacity to manage it. We would like to have a small group help us, steering committee or whatever, very unbureaucratic. We're happy to meet once a month and take stock of where things are going. But we also need individuals to take forward with their organizations or collections some of these strands so that we can move more mobilization together than we could if everything is just done by 3 or 4 people. So that's my plea, rather bluntly and crudely. Give us your time, give us your energy, give us your data information, give us your network, but also give us as little or as much money as you can, please. Is that right, Florence? Is that?
Yeah, better said than I could. Thank you, Pete. That is critical. Of course, you know, we can keep dreaming and thinking of all the things. There are other things we'd love to put on the agenda, but it's none of that can be done without the resource. So all of this decision around panels, format, approaches has cost implication, unfortunately. And right now we're looking at it. Can we afford actually to have this as a hybrid event, and what does it cost? And we're talking $4,000 or something like that, if I remember well, Mara. Like, what? We don't have the $4,000, and so do we cut that? Do we cut Portuguese and stuff like that? I mean, it's a normal part of the process, but we do need resource, both technical, human, and financial to enable us. So
yeah, and we want the collective opinion on this. So
yeah, we
people
do.
Today we've got a great ideas on you know, can we around this do something very different, left field? I love that idea. Can we do something else? So I think, you know, we can be creative, and not all things cost a lot of money, but they do also need people's time to manage them and lead them.
Oh.
So, and I think what we may also wish is the monthly meeting too long apart? And would we get more momentum if we did it every 2 weeks? But we recognize everybody's very busy. And also, we don't want to have to start servicing a meeting that takes time in of itself. So there's a balance there between trying to keep this group together. And we would love you to all bring a +1 next time. Somebody who's not here who will help us. But at the same time, we don't want to be constrained in terms of trying to merge a consensus on how we do this by only waiting for a month before we can have the next conversation. Otherwise, we will only have 4 or 5 more meetings.
No, exactly.
So
and it's big
on that
investment.
note of practicality, I look forward to being inundated with support. Don't we, Florence?
And I've just reshared the shared folder. Let me know if you've got any issue accessing it, but it has a lot of this information, including the matrix or the work stream.
Yep.
You can edit it. If you don't, let me know. You can edit it, you can add stuff, but we really need you to kind of, you know, to input into this, including, you know, everything we talked about around the consultant. And if we don't have that, it's going to be whatever we can, and then you're going to come back and say to us, oh, hang on, but we don't think that was the right thing, whatever. But this is the opportunity, genuinely, to shape this. So can't be done without you. So thank you so much for your time and your contribution, and we will follow up.
Yes. Thank you, everyone. We really appreciate your participation and support.
Thank you for initiating it and coordinating us. Thank you.
Florence, well done.
Thank you, Pete, thank you, Mara, and everybody, and our interpreters, as always, Anna
Yeah,
and
thank
Nora.
you.
Thank you so much. Bye-bye. And Michael,
Bye.
can I grab you 1 second?